Good morning, everybody out in cyberspace. It's Angie Oliphant. I'm the director of Eden Medical Retreat, and we're very, very lucky to have Sally back with us. And she's come here assisting Eden with escorting patients here from Perth. So she's not here as a patient, but I thought while she was here, I wanted to talk to her because she's now 12 months in recovery. She came here on the 28th of August last year. So it's nearly a year by, short of about a few days. So we're really grateful to have her here and to be assisting us in the groundwork with patients or clients, as we like to call them now, who require assistance with their addiction of all forms, whether it be heroin, methylamphetamine, opioids of any sort. So what Sally's been doing is she's been working with us. She's now going to study next year to do the addiction therapy, a therapy course, counselling course, and she's now assisting us just with people that are fearful about coming here, so she can just talk about her experience, and so she's mentoring them to be able to allay the fear that most people experience due to the thought of change. So Sal, welcome back. Obviously, Sally's not your real name, but we use Sally because we want to protect her. I just wanted to ask you a few questions. It's been a long journey, obviously, from the time you came here on the 28th of August last year to now's date. So I just wanted to discuss with you what were the, with your recovery, a few questions as far as you were having problems with the family dynamics prior to going home. How has that panned out now with your parents, your sisters and your children?
Yes, well, it has worked itself out.
Right.
I have a very strong bond with my mum and my dad.
Oh, that's fantastic.
Which before that, when I was on the drugs, I didn't like my mum very much at all. So to actually flip that around and change it.
And change your behaviour towards them.
Yeah.
That's excellent. I know for a fact because you came up for your 40th birthday to reconnect with all the Indonesian people that you've made friends with through Eden. And I had a long chat with them, and they said that it's incredible that your recovery, as your mother said, her very words were, I've got a better version of Sally than before she got on the drugs. So it sounds to me like you've become a lot more compassionate and a bit more empathetic towards other people's feelings, and you've been able to get trust and respect back from your parents and your friends in your circle. As I always said to you while you were here, people always respect people with addiction issues if they are seriously recovering and working hard at getting to their goals, which you set for yourself when you were here. Just talk to me a little bit about your reconnection with your children, because you hadn't been with them for a year. So how's that gone?
Yes, it's good. I've told my children about my addiction, which they had lots and lots of questions about, which I answered all those questions for them. It's a lot easier that they know.
Well, they understand your behaviour before.
They understand. My son actually said, "Oh, Mum, that makes a lot of sense." And it's been a long road.
Yeah, it's not quick.
It's not quick, but it's a lot better being open with children, because then they know when I'm going off for appointments, or they know about my health issues with my heart.
Yeah, I wanted to discuss this with you. I think it's really important that people that are thinking about getting onto meth, because they think they know it's addictive, as you did,
yes,
but they think that they control the drug, whereas the drug controls the personality, the person, and takes and strips everything away from them. I just wanted to let you all know that I've done a video before on the effects of methylamphetamine on the body and what it does to our organs, our brain, heart, depression, mental health, etc. Now, unfortunately, the 5 years that you took the drugs has affected your heart.
Yes, that's right.
Can you tell us a little bit about how that was diagnosed and what the effect on your heart is?
Yeah, well, I was having dizzy spells where I actually ended up falling downstairs. and my psychiatrist actually said, no, there's something not right. So he actually took me off my medication for my ADHD, and then he also sent me to go have an ECG done.
And that's where they picked up the the arrhythmia in your heart.
The cardiomyopathy.
And the cardiomyopathy.
Yeah.
Okay, so the result of that is that you are now only functioning on 40% of your heart.
Yes, that's correct.
So now you're learning to live with a cardiac condition.
Yes.
Which is, what are the symptoms that you're experiencing?
Well, I get fatigued very easily.
Fatigue. That's pretty normal with cardiac situation. Yeah. So this is actually affecting your lifestyle to rebuild because you're not well.
Yes.
And so now, instead of what you were hoping to do, which was to set up a gardening business and get going because you love gardening, you can't do that now because of the damage to your heart.
Yeah.
So the outcome is you're going to have to go onto a disability pension.
Yes.
With the possibility of being able to study next year.
Yeah.
So that you can get into a situation where you can get employed and help people on the ground with addiction, and work with Eden, which is the best thing ever. I think that's fantastic, and you're a wonderful example of someone that has made the decision. It wasn't an easy journey over your 3 months, but I have great pride in you and what you've accomplished over the year, and the fact that your parents were able to forgive all the past misdemeanors and behavioural issues and hurt and stand beside you. And this is something that's really important to all the parents out there. If you have a child or a relative that is affected by methylamphetamine or any other form of drug addiction, we really need for you to stand by that person. And I know it gets tough, and I know everybody is told to have tough love, but when they've gone through the recovery program, whether it be Eden or Shalom House or any of these other places that specialise in recovery, addiction therapy recovery for people, please stand by them and support them. They need you, and they need all their friends, not their drug cultured friends, but friends that they've had prior to their addiction. And they need support, and they need love, and they need to have faith, and we need to be able to forgive. And that's on both sides of the fence. The client that is the addict, when they've gone through the program, we do follow the 12 steps as well as using cognitive behavioural therapy and hypnotherapy. We do get the clients to write letters and journals, and we do ask them to face the people that they have hurt emotionally and physically sometimes, and say that they're sorry. And we do ask the family members that have been hurt to be able to reciprocate. It isn't straight away, it takes time. They have to earn the trust and respect, but please believe me, it is so worth it when you see somebody like Sal, who came here in a very, very bad state and was basically on the point of being wiped out. Fortunately, her parents love her, as all parents do, and decided to support her, and they have been absolutely amazing. So thanks very much to Pam and Jeff, and to the siblings that are involved in this family dynamic. But I do just want everybody to understand that they need encouragement, and they needed to be included, and they're worth fighting for. So never write them off. There is always hope. So thank you very much, and I look forward to talking to you again, and be safe and Godspeed. Bye.